Ngayon, so recording. And then if there are additional questions after, just send it to us at team@medprojects. Okay. So our company is MedProjects. We are a healthcare IT company. We work with hospitals mainly. So we work with them in terms of strategic planning and then implementing IT projects. But we've also worked with integration. We work with other vendors integrating their systems. And we also develop our own solutions for hospitals. Our solution is called Health Engine. So we have an integrated HIS and EMR platform. We really designed it based on the needs that we saw from our clients. Okay, so Health Engine has 5 main components: an HIS and EMR, Ancillary Resource Management System, Medical Records Management System, and a patient portal. Now, about this topic, I've been in health IT for over 18 years. I started in Asian Hospital 2002, and then I went to the US for training. But when I came back, I started working in St. Luke's, and I work on the clinical applications on EMR, smart card, LIS, integration, marami. Then after St. Luke's, I became the CIO, Chief Information Officer of the Medical City. And then after the Medical City, I became CIO of Healthway. So along the way, I developed these concepts that really helped me come up with a framework for planning for hospitals. So when we usually work with hospitals, there are a lot of misconceptions about the IT investments that they need. So sometimes they start with, meron na kaming HIS, ano pa ba ibang kailangan? So actually, meron pa iba pa. No? But it's, meron kasi mga ibang concepts na kailangan natin ma-educate pa yung ibang hospitals. And then the pandemic has really highlighted the importance of the hospitals. So marami tayong mga solutions, startups na nakita natin na meron tayong mga EMR for doctors' practices. Pero inside the hospitals, paminsan napapabayaan ng mga IT groups. But it is the hospital is where we are born, the first days of our life until probably the end days of our life. So napakalaking role ng hospital. And there should be some investment in terms of optimizing in terms of IT. So when I started working with, I became a CIO, started working on plan, I came up with this framework para wala akong makalimutan. Okay, so ginagamit ko itong framework na to. Even when I work with my clients, I use this framework. Okay, so we will, ibang topic yung paano mag-progress from 3 to 5 years planning, but I will focus on these 10 items. Okay. So the 10 items are this one: core transaction systems, operational support systems, ancillary and departmental IT systems, clinical IT systems, telemedicine, data analytics, communications and capacity building, customer engagement, systems integration, and other innovations. So daanan natin sila sa isa. We'll go through them one by one. Medyo marami sila, 10 items. The first one is the core transaction system. This is where a lot of the hospitals focus on. Okay, so this is the first step, always the core transaction. The core transaction systems is the system that initiates, captures, and records the financial transactions of the patient journey. Okay, so this is the core business of the hospital. It is the delivery of patient care in exchange for money. Okay. So the sample IT systems in this is the HIS. If you're a clinic, it's the clinic management system. And within that IT system, there is basic financials involved. Okay, so if you follow the patient journey, you usually start from patient registration until the billing side. But within that module, usually you usually have different modules that help out the different aspects of the hospital operations. So you have admission, For inpatient, you have ER, outpatients for ambulatory, no? Malaking bagay yung billing. But also part of the patient journey is the other departments, pharmacy, dietary, central supply, no? Part sila ng ano. And even with the transactions, you also work with inventory and purchasing. Okay? So merong malaking parang overview in terms of the patient journey. Okay? The core transaction systems focus on the patient journey. So you need a good system to handle patient registration. Even the concept ng pre-registration ngayon medyo malaking pumapasok na malaking bagay na where patients can pre-register online. Of course, PhilHealth has become a very big pain point in some hospitals. Kailangan maganda rin yung concept ng bed management. In some hospitals, lalo na pag malaki yung turnover, kailangan mo ng magandang way to manage your occupancy. Lalo na kasama doon sa process is yung cleaning, housekeeping. No? Bed management is just not a tally. Ilan ba ang available? But also management of ilan ba yung kailangan i-clean, anong oras ba maging available yan, ilan na bang occupied, ganun. No? Sometimes I get amazed at the numbers that we have pagdating sa COVID reports about the number of beds. Kung sabi ko, paano kayo nagawin? In reality, we know na medyo mahirap mag-track talaga ng occupancy rates with the current systems. See? There's also order management. Order management dati has just started out to be all about charges. Bigyan mo lang ako ng 3 tablet, i-charge mo. Okay? But then as we move along, there are concepts of clinical indication, ano ba yung ano, and then even scheduling. So papasok mo rin yung concept ng pharmacy and inventory control, along with the role ng mga clinical pharmacists in monitoring drug-drug interaction. Okay. So inventory, malaking bagay. Inventory has always been a big problem in a lot of hospitals, especially kung hindi maganda yung coupling nung ordering with inventory or even the maintenance sa side ng inventory systems. So kakaroon sila ng problem. Room charges, marami na nag-iba ngayon. Dati it was just straightforward room charges, but ngayon marami ng may socialized pricing, ibang charge pag half day, ibang charge may nag-wave, no? So kailangan maganda rin yung system to be able to handle yung iba-ibang scenario and schemes. Okay, so even yung pag-allocate sa iba-ibang sa payment, saan mo i-allocate. Okay, sometimes you need to work with HMOs, paano yung pasok ng payment galing sa kanila. Okay. And a big problem in a lot of hospitals right now when we work with our clients has always been doctor's fees. So doctor's fees, medyo nag-grow yung problem ng doctor's fees, lalo na pag hindi na-manage ng mabuti. Maging from either it's just professional fee from consult, professional fee from the admission, professional fee from reading, professional fee from radiologist. Maraming pasok, no, yung doctor's fees. So yung hospital has become the manager of all this. Dati kasi yung mga doktor dumidiretso sa pasyente. Ngayon hindi na pwede. Okay. So, sama yung billing. When you work with core transaction systems, so when you have your hospital and you're starting to look at the different core transaction systems, ang HIS ko, CMS ko, one of the things that you need to consider is you need to understand your services. You need to understand your hospital, okay? Your clinic, your network, kung ano man yung requirements. Sometimes you have an HIS, but there are services in your hospitals that are not met by an HIS, just a basic HIS. So sometimes you have a lot of corporate clients. No, you can either have industrial medicine, which is our annual PE per employment na checkup, examinations, and then you even have corporate clinics. Or clinics are inside the companies. No, yung ganun system kailangan mapasok mo sa pag-discuss mo ng requirements. Sometimes you have a different way of handling ambulatory care, urgent care, emergency care. No, then there are hospitals that need to adopt the concept of a one-stop shop. There's some hospitals, depending on the HIS, you go to lab, doon ka magbabayad. You go to RAD, doon ka magbabayad. You go to ECG, doon ka magbabayad. No? So, depende sa setup. Sometimes that could be more efficient, lalo na kung ayaw mo magpila sa isang lugar lang lahat ng pasyente, but sometimes you also need to come up with a one-stop shop where you go in, no, parang concierge, pay for everything, and then susunod yung pupunta na lang yung pasyente doon sa kailangan niya puntahan. Okay? And then part of the core transaction system is to also consider ano yung mga specialty centers mo. Sometimes may mga specialty centers na napag-iiwanan ng HIS, hindi nagagamit. No? So may mga times kasi that, for example, cancer care, yung mga iba kasi, kailangan prior to the visit, na-register na sila. No? May mga ganung bagay. So kailangan natin ma-consider yun when you work with your core transaction systems. Okay? The benefit of the core transaction system is that you capture all your financial transactions as much as possible, all. So kung hindi na-capture yung ibang services, then meron kulang, no? But the goal is to capture all the financial transactions. At least you get to see, get a sense of where you are in terms of revenues. Okay, and then of course, part rin ng transaction introduces efficiencies. Hindi na masyado maraming papel. Okay, so that's just the first one. But if you look at the big picture, the core transaction system forms around 20% of all the IT plans. The next domain is the operational support systems. Okay, so operational support, by its name, is the IT systems that supports hospital operations not related to the patient. So when I started out my work in St. Luke's, dalawa kaming parang hatian. Pag clinical akin, pag non-clinical dun sa isa sa kabila. Okay. So usually a lot of IT plans inside hospitals start out that way. May clinical, meron non-clinical. So ano pumapasok doon sa non-clinical? Usually yung higher level financials, accounting. The bigger the hospital, paminsan may mga pumapasok like may nag-rent, no, na lugar. May mga doctors' clinics na nagbabayad, no. Yung accounting side na yun, that's not part of the patient journey, but that's still accounting that goes to the hospital. Those are the things that need to be managed. Okay, so yun yung mga iba ng requirements. HR, okay, so handling ng HR. Sa St. Luke's, merong customer relationship management system, CRMS. This is where you record kung ano yung mga preference ng patient. No? It's not enough to just say na this is the meal. No? Meron talagang the patient prefers chicken. May mga ganung bagay. No? It's an extra effort, no, para sa mga ibang hospitals. Yung iba naman, help desk, no, ticketing, lalo na kung medyo maraming system na kailangan i-maintain. And meron rin mga ibang hospitals that implement document management system. So the document management system, this is not for the medical records, but this is for the number of policies and contracts that need to be handled, depending on the situation ng hospital. If the hospital is going for an ISO or a JCI or any kind of accreditation, dumadami yung policies ng mga papel. So maganda kung meron kang document management system para ma-handle mo kung nasaan na and ano yung mga versions, no, mga version control. Yung isa naman yung contracts naman, especially if you have a lot of corporate clients, you have different contracts with them, you also need to manage those. No? So that's a part of the operational support, that is a part of patient journey. On this aspect, I'll just try to tackle one of the questions na medyo common is, do we need an ERP? Do we need a full-blown accounting system in our hospital? When I work with my clients, I always try to assess na if you are a network of hospitals, dalawa lang, minimum 2 or more, you gain some benefit when you have an ERP, an accounting system. Okay? Bakit? Kasi the goal of an ERP is for you to adopt accounting best practices. So especially if you have multiple hospitals na iba na may HAS ka na, paminsan hindi nasusunod yung accounting best practices, no, yung mga SOP ng the ERP helps them out. So in a way, it creates the standards across the different hospitals when you have an ERP. However, if you are a single hospital and you have an HIS, and what you need is not an ERP, but just a better way to crunch data. No? Kailangan mo lang, I just need better data. Andiyan yung data, hindi ko lang binibigay mo sa akin in an Excel dump, binibigay mo sa akin in raw. Hindi ko alam paano ko i-analyze ito mabuti. Then you don't need an ERP. You might just need to have better reporting and probably look at initial work on data analytics. We will go into data analytics later, but this is just a question na gusto kong i-tackle ngayon at this point ng operational support systems. Another one from experience na medyo challenging sa ating industry is finding the right HRIS. So sometimes, pag hindi natin alam anong kailangan natin, the HRIS comes in. Yung mga HRIS, they do well with other companies na medyo iba yung requirements. But sa mundo ng hospital, we need to track a lot of certifications and licenses. So maganda kung meron silang ganung function. Yung mga iba naman meron, no? But ma-highlight kasi na dapat meron yan. Especially nag-monitor ng expiration dates and mga renewal dates. Lalo na kung you try to monitor yung PRC, yung hospital rin na tumutulong mag-renew ng mga PRC ng mga staff and mga doctors. Okay. Another feature na medyo importante sa hospital is yung benefit utilization ng mga employees. So part of the benefit that we give to employees sa hospital is they get some hospitalization, some patient care benefits. So sometimes nababawas yun, so that goes into the HRIS. At least alam mo yung level ng utilization. Another is performance evaluation. Medyo marami-rami. Then it would be nice, no? Itong dalawang last, learning management system is meron kang way na mag-onboard ng mga nurses ng iba through a online course and a good way to manage nurse scheduling. So that's for the HRIS. When you look at this second one, the operational support systems, when I was CIO in the medical city, even when in St. Luke's, I would go around the hospital, no? Ikot-ikot ako. Tingnan lang ako, kahit na tahimik lang ako sa isang corner, titingnan ko lang kung ano yung nangyari. Nandun ako sa billing, ano. What you need to look at is paper triggers. Okay? Paper triggers is in a non-automated way, everything is triggered by a piece of paper. Every action is triggered by a piece of paper kung wala ka pang IT system. Okay? Yung mga concept ng charge slips, leave, approval, no? Lahat yan paper triggers. So, meron kang papasahan ng paper para yung kabila gagalaw. Okay? So, pag nakikita mo yun, that's okay, this might be a good parang project for improvement. Nakita mo, ilang papel bang dumadaan? Ano ba yung inefficiencies na itong papel, hawak-hawak pa ng isang tao, hindi napasa? Okay? So, may mga ganun bagay. Napirmahan na, pero hindi pa. Yung leave na tao, ma'am, yung leave ko, napirmahan na ba? Napirmahan ko na, pero hindi ko pa na ibigay doon sa ganito. Ano? So, may mga ganung paper triggers na kailangan mo bantayan. It streamlines the operation, no? And there is less paper. Kung imagine niyo yung paper sa loob ng hospital, sometimes hindi na natin pinapansin kung magkano. But you could reach as high as 1 million pesos to 2 million pesos on paper alone. No? If you could come up with a way to minimize paper, there will be a lot of savings. Okay? And then although we don't want to say it out loud, automation also gives us a leaner staff. So nawawala yung mga redundancies. Tapos mas productive yung ano. So malaking bagay na matutukan rin yung operation support systems pag ready na yung hospital. The third domain is the ancillary. Okay? So this is the parang a big bulk of the operations ng hospital. Diagnostic tests, procedures, interpretations, medical imaging, lahat yan sila. Malalaman mo na these are diagnostics kasi these are often revenue centers. Kaya hindi mahirap mag-justify ng IT project sa mga revenue center kasi there are ways to get it back in a sense. No? So kailangan mo lang ipakita na ano yung projection. But the sample IT systems inside the ancillary, the very first one na lalo na ngayon, kasi wala naman masyadong analog na modality, is the PACS system. So when you buy an X-ray, when you buy a CT scan, no? So lahat yun sila digital na. And you need a way to store them. So that's one of the things na inuuna yung PACS. The second is the LIS, laboratory, kasi because of the volume, CBC, urinalysis, no, blood chem, tinatry natin i-automate yan. Yung radiology, naglalagay tayo. There is a big difference between an RAS and a PACS. Sometimes there is a confusion. Just remember that PACS handles the images. the radiology handles the patient. Parang ganun lang. May mga overlap sila, pero in a way, yun ay parang simplified, parang difference nila. The radiology handles the patient journey. Andyan na ba yung pasyente, yung market has arrived, ano yung demographics, ano yung changes, ano yung interpretation, ano yung turnaround time, no? So yan yung work ng RIS. Yung appointment, yung schedule niya, yung mga ganung bagay. Si RIS yan, doon nag-grow yung features niya. Si PACS naman is about storage ng images, diyan yung viewer nagagaling, diyan yung pag-manage ng contrast, no? So may mga pero nagwo-work sila in tandem. Kaya pagka ibibenta sa yan, risk PACS agad yan, risk PACS. Okay? Yung iba naman, when you have a cath lab, you go into a cardio-PAC system, then you also have ophthalmology systems. Okay? So another system that I first encountered in St. Luke's was the Ancillary Resource Management System. This is where you type in all the different kind of results system. So a sample lang, sometimes there is lalo na kung IT, no, walang hospital background. Ano ba ang meron sa ancillary sa paligid ng hospital? Actually marami, no? If you look at kumuha lang ako ng screenshot ng GE. If you look at the radiology, marami na sila iba-ibang klaseng modalities and mga systems na pwedeng makita. Sa radiology pa lang yan, hindi pa yung sa cardiology. Okay. So ito naman sa Siemens, no? Ito naman yung kanilang medical imaging. Lahat ng mga images na nakukuha dito, medyo challenging yung iba, like an ultrasound. Yung ultrasound medyo challenging siya kasi sometimes it's a moving, parang movie siya. Paano siya i-store, no? Yung mga ganung bagay. So lahat yan papasok dun sa planning ng storage. I've worked with the eye center of the medical city. We work with forum. Tapos yung technician nag-handle ng retinal images, tapos ibabato doon sa store sa PACS ng eye center, tapos babasahin ng retinal specialist. When I was in St. Luke's, one of the first projects, I was there 2007. One of the first projects that I handled was called ARMS, Ancillary Resource Management System. So hindi kasi enough na yung LIS lang ang digitize, yung RAS lang ang digitize. They really targeted na lahat sa loob ng hospital digitize. So marami kasing napapag-iwanan, lalo na kung hindi ma-afford ng hospital yung mga high-end GE, high-end na Siemens na counterpart. So we try to work with our clients to develop a system. We call it also ARMS that handles the different units. Okay? Another challenge inside the ancillary, no, especially when you work with the HIS, is the concept of workflow. So iba-iba yung workflow. Sometimes merong technician na magbabasa, merong technician, merong encoder, transcriber na magsusulat, no, magdi-dictate yung doctor, tapos merong magpa-finalize. In some instances, there are two readers, no? So may mga hospital na dapat dalawa magbabasa. Okay? So may mga ganong workflow na paminsan hindi naka-capture. Pero malaking bagay siya kasi it creates inefficiencies, tumatagal yung basa, hindi na Okay. Challenge rin yung complex forms sa loob ng That's why one of the things that we targeted when we started building these ARMS is good forms management para lahat ng forms ma-capture. And challenge din dun sa iba, lalo sa current LIS, is ngayon na may mga bagong tests na lumalabas, no? I think COVID-19 will introduce other tests and lahat ng pa. So paano mo i-capture yung kaagad dun sa LIS mo without additional systems? I'm sure yung mga ibang hospitals dito bumili ng system just for or nagbayad, no, sa ibang just for the COVID test. And then yung challenge ko dito is to make it accessible outside kasi kung kailangan i-verify. Okay. So that's one of the things that we are working on para ma-access because our clients need it. Okay, so you cannot ignore the ancillary in the Department of IT Systems because they are the biggest source of automated generated clinical data. Okay, that is they are like a factory of clinical data. So napakarami talaga niyan. Kung wag mo i-define yung ancillary by the system, you define it by your services, hindi enough na magsabi ka may LAS, RAS ka. Meron kang nuclear med, meron kang ECG, even meron kang hemodialysis. Lahat ng mga ano yan are sources of clinical data. So kailangan mo tingnan kung paano mo sila i-automate. Okay? Kung titingnan mo lahat ng ancillary, they form around 40 to 60% of hospital revenues. Andyan ng actually maraming pera sa loob ng hospital na nasa ancillary. Kaya kung meron silang way na ma-justify yung kanilang purchases. Okay. Now, if you put in an IT system that improves operation, it almost always translates to better revenues. Especially if you put in a system that allows lowering of cost. Okay? And then, kung mas mabilis, sometimes yung test, kung maganda yung system na pinasok, imbis na it takes 2 hours, nagiging 30 minutes na lang, mas dumadami yung volume na kaya ng hospital. Okay? So more revenues. And then it improves service. So mas maraming pasyente. Sometimes ang hindi natin nababantayan when you look at all these systems is, we get a lot of our ancillary IT systems based on parang reagent tie-ups. That's part of the sa side ng LAS or sa ibang ano. There's always this tie-up in exchange. Pero if you manage your system very well and you look at your data, nakikita mo ba, marami ba ako nasasayang na reagent? Paano kaya kung bawasan ko? Paano kaya kung bayaran ko na lang agad yung LAS imbis na mag-reagent tie-up ako? Okay? So, may mga ganung bagay na kailangan tingnan. Sometimes, when I was medyo wide yung experience ko, makita mo na, ganito pala ginagastos natin sa reagents. Nagagamit ba lahat? No, actually, sir, sasabihin, almost 30% natatapon natin kasi we are just required because of the tie-up to buy it. Ay, ganun. So, kung i-compute mo, imbis na itapon mo, igawin mong savings, mababayaran ba natin yung binigay nila na libre? Oh, okay. So, yan ganun yung approach ko sa ancillary. Marami kang efficiencies na pwede mong tingnan dyan sa loob ng ancillary. And it reflects into revenues pag maganda yung analysis mo. Okay? The fourth one is the clinical IT systems. This is where we go into the realm of the EMR. Okay? So, I just need to in a way define the EMR kasi maraming nag-hijack ng EMR na term. The EMR is real-time access to patient information. Bali, paglabas ng results, titingnan ko siya sa system, sa EMR. It also captures data from various clinical data sources, which means that pag gusto ko tingnan yung CBC, gusto ko tingnan yung X-ray, gusto ko tingnan yung ECG mo, doon ako titingin. Okay? Hindi ako titingin ng CBC dito, titingin ako ng X-ray sa papel, titingin ako ng ECG sa papel. That's not an EMR. Okay? So kailangan meron kang ganung klaseng point of view when you look at this plan for the clinical IT systems. Hindi siya madali, but that is the reality. If you want doctors to use it, kasi the third definition is that it is used by clinicians as a source for information, kailangan as much as possible nandun lahat. Titingin ako ng CBC, X-ray, ultrasound, lahat ng mga interpretations dapat nandun sa system. Okay? So medyo complex yung mundo ng clinical IT systems. We will have a different presentation about this, but sa loob ng isang IT system, there's a clinical data repository that handles all the results. Merong clinical documentation, notes from clinicians. Tapos monitoring sheets from nurses, mga vital signs, EMR, yung pag nagbigay ka na ng gamot, nag-administer ka na ng gamot. Okay? So maraming concepts na pumapasok doon. E-prescription, patient registry. So marami. This is really targeted for the clinicians. If you look at the patient journey, yung core transactional, that's really handling the financial transaction. Operational systems gives the support to the hospital operations. No? So ancillary para sa ancillary side. Yung clinical IT system is, this is the time you look at your nurses and you look at your doctors. Ano ang kailangan nyo para mas maganda yung service niyo? So this is the aspect ng clinical IT system. The biggest EMR in the world is Epic. If you look at their modules, so they're the biggest EMR software in the US. Revenue cycle, the handling of the patient billing is just one aspect. They have different aspects as part of their modules. Okay? So you get an idea na ano ba ang mga operations na pwedeng ma-automate. No? Okay, so even in their world, they look at specialties and ancillaries. So marami silang ginagawa nila ng special, dedicated modules for the following. Okay? So maraming challenges sa loob ng, if you look at an EMR, you cannot avoid looking at different specialties kasi iba-iba yung challenge. Iba ang challenge ng OFTA documentation against pedia documentation, no? Against surgery, ortho, no? Iba-iba, no? So iba-iba yung challenges niya. If you really want to grow your clinical IT side, you really want to go towards paperless, you really want to look at an EMR, hindi lang enough na magsabi may EMR ako, kung sabi meron akong form, mag-type mo doctor. No? You need to understand the different specialties and mga requirements. Sample lang rin galing sa Cerner. Okay. This is the oldest EMR. This was developed in around 1970s pa, but still being used. Iba-iba yung mga functions niya, clinical functions sa loob ng ano. I'm just showing this para maintindihan niyo na maraming functions ang isang clinical IT system. But the first activity should be consolidation of a lot of the different data na gagaling sa iba. Para yung EMR magamit, no? Even the ability to look at a patient portal. Pero yung mga doctors, meron silang way na makita. It would be nice na if you have a view, na makita mo na lahat, no? So you can see all the different tests in one system kasi nagko-consolidate ka ng data. And that's the purpose of CDR. Along with the different clinical documents. No? So maganda kasi kung meron kang way na makita mo anito na yung operative technique, andyan na yung evaluation, CP clearance, no? Research summary, nandyan na sila lahat. Nakikita mo na. Okay. This is a sample of the operative technique that we work with sa aming clients. Ang isa sa mga malaking challenges ngayon, especially for doctors, is the CF4. No? So the CF4 almost acts like a research summary na merong course in the wards, meron pang ibang lahat ng iba. Yung mga ibang doctors na nagrereklamo na sila paulit-ulit yung tina-type nila, sinusulat nila. Kasi nagagaling tayo sa mundo na ini-start mo natin sa dulo. Ini-start natin sa dulo kung saan maglagay ka ng forms for claims. No? But mas maganda sana if we incorporate clinical documentation from the start where we look at automating a lot of the processes. Makita natin that anong ginagawa natin during the course of patient care, pumapasok na doon sa loob ng CF4. Tapos ang nangyayari na lang is i-review na lang ng doctor bago i-submit for claims. Okay? So if you are able to document the course nung disease, nung care, mas maganda. No? So this is just a sample of the assessment form that we do for our system. Okay. So the clinical IT system is not an easy system to implement. So when we talk with hospital sometimes, meron na kaming EMR. Okay, yan ba yung ginagamit ng doctors and nurses ninyo? Hindi, pero meron na kaming EMR. Okay, hindi na ako makadebate kasi it's really a difficult system. Hindi siya madali. Kung hindi kayo nahirapan, para sa akin hindi siya EMR kasi it's really an important. Lalo na when you work with the clinicians, medyo may konting struggle doon sa aspect na yan. When you try to look at the clinical IT systems, you need to look at the clinical workflows, the specialties, and you also need to consider the concept ng multi-specialty care, no? Multidisciplinary care. Ibig sabihin, when you try to create documentation, almost all documentation will come from different people. May cardio papasok, may attending na papasok, may nurse na papasok, may PT, rehab, no? So maraming papasok yan that forms the bulk of the EMR. So kailangan tingnan mo yung side ng clinical documentation na yun. But evidences show that there is really improved clinical outcomes with EMR, better patient satisfaction, and there's a reduction in errors. So we don't need to debate about the benefit. Marami talagang benefit ang EMR. That's why andun talaga pupunta lahat, not only the US, even the big European countries, and na papunta sa EMR. Okay, so halfway na tayo sa telemedicine. Okay, telemedicine used to be part of, when I created this framework, used to be part of other innovations. Okay, kasi konti lang gumagawa dati, no? But with the pandemic, medyo nag-boom siya. But in essence, telemedicine is the delivery of patient care remotely, via IT. Yun lang ako tubig sandali. Okay. So the most common use case in telemedicine has been teleradiology. Now, even before the pandemic, years ago, teleradiology andyan naman lagi. Even when you buy a PAC system, there's always this ability that it can be read outside the hospital. That's teleradiology. That's part of the big umbrella of telemedicine. Tapos doon na papasok yung iba. Anything that has images, anything that can be captured, anything that can be scanned, can be sent. So telecardiology, ginagawa na ng ibang hospitals yan. Pagka nag-ECG yung patient, i-scan nila, babato nila. Okay? Pero nag-grow yung requirements ng telemedicine. Okay? So pumasok na yung tayo ngayon sa mundo ng teleconsult. And when I was in the medical city, we experimented with mga remote machines. Yung machine nandoon sa side ng patient, tapos ang magbabasa, magtitingin ng video is the doctor. So you'll have the machines, nasa pasyente, ito kunwari pasyente siya. Tapos yung mga doctors, nakikita na yung video. Nakita nila ano yung tsura ng throat, may illumination, ano yung tsura ng tenga, pwedeng, sometimes nurse-assisted. Okay. Another one of our projects in the medical city, this is an old project, is the use of, kasi merong mga iba-ibang hospital, the ICU of the other hospital will refer to the intensivist ng main hospital. This is the intensivist, one of the top intensivists in the country, si Dr. Japalo. And then, so he's reviewing yung mga cases doon sa other hospital. So this is a tele-ICU. Okay. So, with the pandemic, nagkaroon tayo ng boom in terms of telemedicine. So, the DOH has parang in a way recognized that telemedicine is a real path for patient care. Dati kasi meron tayong debate, pwede ba yan ma-reimburse ba yan? Mga ganong bagay. But with the pandemic, biglang overnight, telemedicine naging acceptable aspect na. But a lot of the hospitals struggled with telemedicine in the sense na ano talaga gawin natin? Okay? I think it's important to realize that telemedicine just adopts very specific fundamental technologies pero piece together in such a way na mag-deliver ng ibang klaseng solution. Okay? So, pasensya na sa drawing ko. Tinamad ako maggawa ng graphic, so drawing ko na lang. You have video telephony that's has always been with Skype. Even the Skype, wala pang Zoom, Skype tayo, Messenger. So, meron yan. If you have an EMR, so that's why a lot of the private practitioners during the telemedicine, naka-adapt sila kaagad kasi meron silang EMR. But this is a challenge inside the hospital kasi we are not just looking at the episodic care doon sa side ng doctor. We are looking at the care nung sa loob ng hospital. So this is a challenge inside the hospital. We look at appointment scheduling, how to handle payments, and even at the idea na how do I order para iba to po sa hospital. So I'm looking at sa perspective ng hospital na telemedicine na nag-grow sa side ng DOH is sa side ng doctor practitioner nag-grow siya. Sa loob ng hospital, meron na mga platforms na pwedeng gamitin pero hindi siya all integrated in such a way na seamless siya. Na kaya mo bali na nabayaran ito, mag-teleconsult ako, this is a cancer consult, I can look at the history ng cancer ng patient dito sa aking hospital records, nakita ko lahat ng labs niya dito sa loob ng hospital at mag-follow up kami. After ng follow up, gagawa ako ng order at dun sa order, magbabayad yung pasyente. Wala pa tayo sa mundo na yan. But that's a big challenge. But I'm just saying that a lot of these technologies are already there. You just need the imagination na para i-piece them together. Okay? So, a lot of the use cases are already available, pero kailangan natin ng maintindihan ano yung kailangan. So, supporting technology is store and forward. So, telemedicine, this is part of image. I'll store it and forward. Actually, may mga kasalanan rin tayo dito in terms of telemedicine. Sometimes ini-email natin sa personal email ng mga doctors, no? So that's not exactly best practice. But with the telemedicine, it has become a viable alternative source of revenue for some hospitals. Okay, so when the pandemic came, kumunti yung admissions, kumunti yung elective, kumunti yung hospitals are looking at a way to continue the delivery of care outside para sa existing patients, to expand the reach na dito kayo sa hospital namin kasi kaya namin mag-care sa inyo, and then to look at other sources of revenues. Okay? So malaking bagay rin yung concept ng inter-hospital referrals. Even for hospital networks, kung part ka ng isang hospital network, telemedicine can be useful, no? Para at least andun yung pasyente pero wala yung specialist, pero yung specialist mo doon sa kabilang hospital, pwede kayo magkaroon ng collaboration, no? And that's part of the hospital side telemedicine. Okay, so andun tayo sa halfway point. Data analytics. When we work with data analytics, maraming words na lumalabas. Data analytics, business intelligence, no? Ako, tinatry ko lang i-simplify. Huwag na natin pa-complicahin pa. Data analytics is data management. We focus on the data. You should have a strategy on how you manage your data. Okay, so sometimes, nararamdaman mo yung data analytics need pag yung reports na nakukuha mo sa HIS mo, sa core transaction, hindi na enough. Anong kailangan kong gawin dito? Bakit hindi ako maka-extract? Bakit hindi ko alam kung anong department may pinakamataas na revenue? Bakit hindi ko alam kung ano ang cost nito? Ano ang profit margin nito? May mga kailangan mo i-crunch, no? So titingnan paano yan. Huwag mo nang toxicin ng sarili mo, isipin mo hindi kaya ng ano. You come up with a plan to do data analytics. Okay? So the sample IT systems later, the reporting modules. If you have IT people here, we are exposed to parang data warehouse, no, the cloud, data lake, no. Okay, those are nice concepts. But inside the hospital, you just need to extend yung requirements ng data mo. So kung may census ka, kailangan mo i-crunch. Ano yung distribution? No? Parang ganun. No? So ini-extend lang. So sometimes hindi enough yung kaya ng HIS. So you need to look at the databases. Ang isa sa pinakamalaking misconception when we work with data analytics inside the hospital is you demand all the data crunching from your transactional systems. This is a learning na na-realize ko even when I was working in St. Luke's. The transaction systems are there for a specific purpose, to capture transactions. Now, if you want to crunch data, if you want to come up with different twist and turn nyo yung data nyo, hindi nyo kaya gagawin nyo sa transactional. You need a plan. Okay? So this is the plan. No? Pasensya na dun sa drawing ko. Medyo mahangin kaya nakatagilid ng konti. Ang plan is, you need to take out all of your data. Kailangan nyong ilabas. No? So meron tinatawag na ETL, extract, transform, load. Meron rin yung staging database, no. So ito nasa technical side na hindi na kailangan alam ng management, but in a way hospital management, as long as you agree on the plan, you support your IT to come up with this. These are not things that you need to buy at the start, kasi all of these will have databases. So you come up with a database inside where you stage the data. Okay, sabihin natin gusto ko makita ano ang turnaround time from the HIS to the LIS hanggang sa ma-release. No? So yung data na yun magagaling sa dalawa. Kailangan nyo ilabas yung dalawang data na yun para ipagtabi sila. May mga ganong aspect. Okay? So even the idea na ano yung may pinakamalaking profit margin, may cost control ka dito sa ERP, meron kang revenue, mga ganong bagay. So sabi ko lang is kailangan nyo ilabas. No? And then pagka maayos yung plan, you go towards this one, data warehouse and data marts. Nag-create ka na ng maliliit na mga data marts para batuhan mo, and you can come up with specific reports. No, may mga data mart for finance, may data mart for management, may data mart for marketing. No, so ganun dapat yung plan. This is a practical implementation of data management. That's why when we started working on our product, we immediately from day one, data analytics is a part of the whole architecture ng concept. Okay. So these are the things that we want to target. Kasi these are, when we work with our clients, lalo na pag sa strategic planning side, we try to get old data and then we crunch them. Pero ano pa kami Excel, no? Kasi hindi naman sa amin yung system. So yung mga learnings namin when we try to crunch the data from other systems, tinatry na namin i-ayusin para maging malinaw na in terms of the analytic side ng aming ginagawa ng product. Okay, so malaking bagay na naka-keep track mo yung mga census, no? Especially for the year. Lalo na kung meron kang specific targets. Let's say, meron kang target na hinahabol, no? So at least meron kang way na matrack, no? So, ganun. Sa management naman or sa quality, gusto mong i-track yung average length of stay, no? Even the side ng distribution. Yung isa naman na na-appreciate pagka nag-try kayo mag-crunch sa aming clients is yung distribution ng patients based on, ito kasi itong sample na to is this city, but we also work with barangay, lalo na pag na-capture ng transaction system. So alam mo kung saan barangay nanggagaling yung pasyente, no? One of the things na may mga reality is pumapasok na yung barangay na may pinakamagandang jeepney route papunta sa hospital mo, yan may pinakamarami. Mga ganung bagay na realize mo yan pag nagka-create ka ng mga analytics na gano'n. Okay. So when you try to do analytics, it's easy to get drowned in data, no? So as much as possible, avoid the data overload. Wag nang kumuha ng data just because nandiyan. Kasi may katapat rin na trabaho dun sa mga tao yan. What you need to focus on are KPIs, key performance indicators. So kunyari kung ang KPI mo sa isang ancillary is turnaround time, yung isa naman is number ng deals, yung isa naman ganito. So kailangan tingnan mo kung ano. Tapos doon kayo mag-focus, doon nyo ayusin yung data management strategy ninyo para mag-match doon sa KPI. Now, the KPI reporting, hindi siya available sa core transaction system. Kailangan mo talaga siyang planuhin ng mabuti. That's why in Health Engine, yung product namin, we are looking at ilalagay na yung KPI, yung mga standard hospital KPIs, medyo part na siya doon sa development para gawa na agad. One of the things also when it comes to data management is the management of yung encoding, no? Saan nagta-type yung mga clerk. Kasi pag hindi mo naka-capture yung data, no? When we try to crunch sa marketing side, gusto malaman ng hospital, ano ba yung mga barangay pinakamarami namin sa pasyente? Kaso pag tingin namin sa data, puro blank, hindi pinasok. So kahit ano pang crunch natin, kung hindi pinasok yan, mahirapan tayo. Then another challenge has always been the cleanup. No? Cleanup, lalo na pagka double entry or yung pasyente dumating sa iba-ibang araw, iba-ibang record ang lumalabas. No? So, yung mga cleanup na nangyari. Okay. So, but the biggest value when it comes to data analytics is a better understanding of the situation. It allows the management to make informed decisions. Saan ba tayo pupunta? Saan ba tayo saan ba yung pinaka maayos natin na service, no? Saan tayo tututok in terms of marketing? So, meron kang way na come up with decisions na mas maayos. The seventh one is communications and capacity building. This used to be part of the operational support system. Kung makita nyo maraming, dati when I was starting out, halos itong apat lang tinututukan ko. But the hospital has evolved, no? In service ng hospital has evolved. So dapat yung systems natin nag-evolve din along the way. We don't look at it na yung anong system nung 2000, anong system 1990, applicable pa ba ngayon? Hindi na. No? Kailangan medyo meron tayong konting awareness na ganda. The hospital, the services has evolved. We also need, the IT systems also need to evolve. When it comes to communication and capacity building, ang focus naman natin is improvement ng productivity, ng interaction ng hospital staff. Titingin tayo sa loob. Okay? So, ano ba yung mga sample IT systems na meron dito? This is email. Okay? So, naintindihan ko that some hospitals nagtitipid. They will not give email to everyone. No? But at least give an email to the department. Kasi sometimes gusto mo mag-email sa manager ng laboratory, wala pala siyang email. Bigyan mo na ng laboratory department at ibig sabihin you try to maximize the use ng kung anong meron. Kahit nang titipid ka ng individual, give the department some, tapos at least manage. when I was a CIO, I also implemented instant messaging. Meron kami maliit na module system dun sa na mabilis lang maghanap ng tao all across the hospital. So mag-type ka lang, makausap mo na. Okay, meron rin file servers. I'm sure there are hospitals here na may mga file servers sila. Pag ito yung report na to, dito mo kunin, nakatago dyan, internet. These are just basic, no? But the thing is, the solutions are already there. You just need to put it at the right problem. What I want to highlight here is that in the years that I work with hospitals, I realized that hospitals have a high tolerance for ineffective communication. I think you also need to, after this talk, if you go back, you need to be brutally honest. Ano yung natotolerate mo? Hindi mo na contact, tapos kinabukasan na lang sinabi sa'yo, na-tolerate mo. Okay. Binigyan ka ng papel na wala yung papel, na-tolerate mo. Tinext lang sa'yo na hindi na ulit, na-tolerate mo. Okay? So sa loob ng hospital, there is a very high tolerance for ineffective communication. Ma'am, kailangan kong tawagan yung admission, tawagan mo yung housekeeping. Nag-ring, hindi nakasagot. Pero wala kang way na mag-iwan ng message. So 1 hour, 2 hours, nakalimutan ko balikan. No? That's very ineffective. If there's a way to message para makita niya, ma'am, nalinis na ba yung ganitong room? Ma'am, nandiyan na ba yung discharge? Nagbayad na ba? Ma'am, so yung ineffective communication na yan gives a lot of inefficiencies na can create a negative impact doon sa patient journey. So, kung meron kang imagination para mag-improve ng hospital mo, pwede mo tingnan ito. Very simple lang. The idea na pag alam mo na nabayaran, alam na nung nurse kagad sa taas. Okay? O alam na nung sa taas na may go home na, pwede na may notification sa baba. O yung housekeeping, malinis na, may ganito. Na-discharge na-notify yung housekeeping. Marami kang ways to create effective communication inside your hospital. Okay, so this is one aspect, lalo na ngayon, when you have a lot of your team members, you do it in such a way na skeletal ka, tapos yung iba na sa labas, sometimes the managers are outside. Kailangan mo ng mga decisions, you need better communication. So you don't need to overthink this. The simplest solutions can provide the great benefits. Okay? So sometimes kailangan mo lang ng imagination. But let us be aware of data privacy and patient confidentiality. So hindi na tayo maging masyadong ito. Wala tayong HIPAA dito sa Pilipinas. Pero meron tayong data privacy na minomonitor tayo. But marami rin tayong kasalanan dyan. Lalo na if you look at how we use text and Viber sa mga hospitals. Nag-text ka ng lab results, nag-text ka ng discharge, diagnosis. No? So may mga pumapasok na may mga breaches dyan na alam naman natin yan. Hindi lang natin sinasabi. But if you create a good communication plan, no, this is going to give a lot of benefit sa hospital. The biggest value here is that you get the right things done faster. Mas mabilis. Imbis na mag-aantay kayong papel dumating sa iyo para sabihan ka, na-notify na. Imbis na tawag-tawagan mo, sandali, hindi sumasagot. Merong reminder, merong notification. Nasabi ko na, antay na lang basahin. No? Yung mga ganun, kailangan nyo lang mag-extend ng imagination. Sandali, may na-notice ako sa chat. Okay. So, malapit na tayo. Customer engagement. This is a very important one. Customer engagement is when we talk about customers of the hospital. Sometimes, when you talk about mag-strategic planning ka, you just look at the patient, is the customer, tapos kung meron kang high level of parang enlightenment, the doctors are also customers. Yes. No? But in reality, if you look at it, the companies, the hospital staff, including the public, are customers. When it comes to the concept of customer engagement, you need to engage. No? So hindi lang enough yung patients. In patients, there's a level of engagement that you want the patients. Meron ka ring level of engagement that you need from doctors. Lalo na kung marami kang doctors na iba-ibang ang hospital. You need to engage them. You need to get their loyalty. Yung mga iba namang hospitals, they also need to engage with the companies that are their clients. Lalo na kung marami kang corporate clients. Lahat ng APE nila, binabato sa iyo. No? So maganda. No? So you need to engage with them. How do you deliver yung report? How do you no? Kasama yung HMO. No? So marami. Kailangan medyo medyo wide yung pananaw mo sa customer engagement. Okay? So hindi ka na kailangan lumayo dito. There are basic tools that can help improve customer engagement. Yung website lang, malaking bagay. Okay? So a website and mobile apps and even the availability ng social media. This can make a difference doon sa sa side nung kung sino man yung gusto mong engage, lalo sa patients. Okay? So gusto mo malaman, meron ba itong ganitong test na to? Paano ko malaman? No? Meron bang ganito? So, yung kabilang hospital may website tapos ikaw wala. Ang meron ka lang is number. So, nag-check siya online. Isipin mo kung saan pupunta yung pasyente. Diba? So, a big, doon sa spectrum ng engagement, the biggest, pinakamalaki on the clinical side are the patient portals. So, we started working on the patient portal even before we created the product. This has always been a concept when I was in St. Luke's in the medical city to come up with a patient portal for hospitals. Okay, so we built a patient portal where the patients can look at their results. So nakikita nila lahat ng results nila through the patient portal. They can also book an appointment through the patient portal. And ang pinakamalaking bagay is this. Remember that I'm always talking sa side ng hospital is there's also this engagement with the patient in terms of other services. When online booking came about last year because of the pandemic, marami nakatutok doon sa concept ng e-consult. No? So puro e-consult. But then, nagkaroon na parang nag-rest yung mga hospital. Sabi, okay, tayo bakit e-consult lang? Hindi ba tayo pwedeng mag-send out ng ating labs doon? Di ba tayo pwede maraming mga bagay na pwede pala ng medication delivery. So this became an extension of the patient portal na kailangan yung patient portal kaya mag-engage not only in terms of e-consult, telemedicine, but also all the other services na kaya yung going home visit. No? So imagination lang kung ano dito. But when it comes to the patient portal, a lot of the studies in the patient portal has always concluded that the patient portal increases patient loyalty. Okay, so as much as 2.6 times more likely nagstay sila. So, ganoon rin naman kahit naman sa atin if we engage with our banks, no? Yung bank na meron tayong convenience, nandun yung ating pera, andun yung ating records, andun yung ating medyo meron tayong loyalty kahit na may mga araw na naiinis ka, kung di maganda, laging down o man, hindi ka naman nilipat kagad the next day, doon ka pa rin. So there's this sense na pagka maganda yung engagement mo, especially when in terms of keeping records, you develop loyalty. Okay? So when it comes to engagement, I always look at the different eyes. You always start with information. The website is just an information. It would be nice if you move towards interaction where you interact with kung sino man yan. Kahit the idea lang na kaya nila magtanong, back and forth, maganda interaction. Then there's also innovation. You innovate in terms of how you engage. So depende yan kung paano ka whether magbigay ka ng card, loyalty card. This is where you per hospital lang ang approach ito. Okay? But the biggest value in terms of is patient loyalty. The more that you retain patients, the better. Kasi yung retention translates into follow-ups and also translates into referrals. So maganda marinig sa hospital natin na yan ang hospital namin, yan ang hospital ng pamilya ko. No? Hindi yung tipong saan ka pupunta? Kahit anong hospital lang pwede. Ayaw mo marinig yun. Gusto mo marinig na yan ang hospital namin. Okay? So this is the area na papasok yung customer engagement. The more that you get engaged with your patients, the more na marinig mo yan ang hospital ng pamilya ko. Okay? And of course, it translates into better revenues. Okay. So malapit na tayo, konti na lang. Dito sa systems integration, this is very simple. This is the need to make the different IT systems talk to each other. Okay? So you minimize a lot of them. I made this last. Hindi ibig sabihin kasi last sa priority. Ginawa ko siyang last kasi kailangan ko muna ipakita ano yung big picture. Kailangan nyo makita na maraming systems pala sa loob na kailangan i-integrate. Pasensya na sa drawing ko. There is the transactional systems. There are the operational support systems that need to talk to each other. There is the clinical side, the ancillary, patient portal, no? Yung data reporting, ano. Lahat yan sila as much as possible dapat nag-uusap. Can you just imagine kung ang trabaho lang ng IT nyo, mag-extract ako dito, ibibigay ko sa finance. Mag-extract ako dito, ibibigay ko sa HR para alam yung important. Mag-extract ako dito, naka-Excel, babato ko. That's not efficient. Okay? So you need to come up with a plan from day one as much as possible na integrated lahat sila. Okay? So nag-uusap na sila na kaya nila magpasahan. Kung mayroon akong results, ikita na alam na ng ano. Kung mayroon akong order, hindi ko kailangan ng charge slip, panalaman na ng system. Mga ganung bagay. Okay, so even in terms of the EMR side, lahat ito nagbabato, naka-integrate. I will share, this is a very recent project that we did for the medical city. I was the program director. I led the whole project. So it wasn't just an implementation of an EMR. It was also the integration of other systems. Imagine nyo, mag-integrate ka sa PhilHealth, mag-integrate ka sa ERP, integrate ka sa document management system. No? So sobrang dami ng integrate, meron na kami deliver. Natin kayanin sa timeline. Ito na muna, iwan na muna natin to kung pwede, pero habulin natin kung kaya. Okay? Tapos meron na kami plan on ano gagawin sa legacy data na maiwan kasi you need to crunch it. No? So kung makita nyo, dapat ganito yung magplano. Lalo na kung lumalaki yung hospital. So kung maliit pa lang, wala namang problema. Hindi naman ganito complicated. But I'm just saying na if you understand the big picture inside the hospital, if nakikita nyo na gaano kalaki, then integration becomes a very important aspect. Okay? So don't forget about the non-HL7. The non-HL7. Kasi sometimes kung makita mo lang, kailangan ko lang mag-integrate ng labs to the HIS. Okay. So medyo straightforward na akala mo yun lang kailangan. Hindi. Kasi si finance kailangan ng ganito. Si HR kailangan ng ganito. No? So, pwede pala. No? So, tapos, ang pinakamalaking bagay dito is a lot of the solutions, you already have them. Okay? So, kailangan mo lang na mag-experiment. Sometimes, hindi mo kailangan bumili. Sometimes, meron naman available on open source, kailangan mo lang mag-experiment. You just need to take time to study them. Okay? So, integration leads to efficiencies and effectiveness, pero it's also a way to innovate for hospitals. Mahirap magsabi na we want to innovate pagka hindi ka integrated kasi hindi ka makabato ng data to other innovation. Gusto namin ng data papunta sa patient. When the patient comes in, gusto namin bato yung results sa'yo. Pero hindi ka naman integrated. Mahirap. The last one, ito na tayo sa last, are other innovations. So I will not dwell too much on this, but this is important because the other innovations come in to play when you really want to be different from others. Okay. Sometimes you just need to operate. There's nothing wrong with that. Gusto lang namin mag-operate. We want to be a hospital that operates and makes money. Okay. That's fine. But there are others who are driven. Now we want to be different. We want to be competitive. Okay. Ang paminsan narinig ko, especially from the provincial hospitals, is we want to be the St. Luke's of our region, of our province. Okay, then you need a different mindset. Okay, a mindset that is more strategic, medyo competitive. Okay, so kailangan mo tumingin kung saan ka maka-create ng advantage. Now, these are just sample technologies na nakikita natin sa news. Okay, this is the news. Top 10 healthcare trends in 2021. Okay, so merong AI, mapasok, telemedicine, nandyan pa rin. No? There will always be variations of telemedicine that we can explore. We are not done exploring telemedicine, especially with the rate that COVID is going. There will always be a need to do some things remotely. So we need to explore on how to maximize telemedicine. Okay? So mobile health nandyan, big data dito. Cloud computing. Okay? So medyo mahina pang Philippine hospitals in terms of cloud computing, but there should be some way to look at how to maximize yung mga servers sa cloud para hindi na mapuno yung mga servers natin sa loob ng hospital. Okay. The focus, when we work with other innovations, pag ako, when I was in St. Luke's, the Medical City, even with Healthway, I always try to look at the problems na kaya ko i-solve through innovation. And when I talk about innovation, I always talk about something cheaper. Para sa akin, kung mahal yan, hindi yan innovation, binili ko lang yan. No? Okay? So kung ang innovation para sa akin is na-solve ko siya ng mura, nag-innovate ako. Okay? So kung ganun ang mindset nyo, you look at the problems and there will always be some kind of solution out there na kaya. Can be viable, can be practical, and sometimes it can be cheaper kung ano binibenta sa'yo. Kasi kung ang definition mo ng innovation is bumili ako ng ganitong system, you're not innovating, you're just buying. Okay? That's okay. No? Wala naman problema doon. If you have the money to buy and you don't, then okay. Other people has done the innovation for you. You just need to buy it. That's okay. Pero kung gusto mo magtipid, wala kang choice. Kailangan mo mag-MacGyver. Kailangan mo mag-innovate. Okay? So when I talk about innovations as the last one, it's about the problems you have inside and you also want to find viable solutions na meron naman sa labas. Okay? So that's it. That's the 10. Alam ko medyo marami, but I'm hoping na medyo nakatulong naman in terms of planning. When you put everything together, what I want people to do is to appreciate lang the possibilities. Don't get overwhelmed by the number 10. No? You don't need to do all the 10 all at once. On year 1, ma-overwhelm ka. Mag-resign mga tao mo kung lahat yan sinabay-sabay mo. Okay? And also be realistic with your IT budget. I think that's the reality. Even the big hospitals that I've worked with, St. Luke's, the Medical City, even Healthway, lagi kami nagdidebate about IT budget. Okay? So ito ang gusto nyo, ito ang kailangan nyo, ito ganun. So kailangan realistic tayo. Kung ito ang budget mo, kailangan, kung hindi kaya pero kailangan mong gawan, doon ka nag-i-innovate. You put everything together by coming up with a plan. This is going to be a separate discussion how to put in, but so the basic knowledge na gusto kong i-share in terms of planning is there is always a level that the organization can tolerate in terms of projects. You cannot do 5 projects at once. As much as possible, mga 2 to 3 major projects lang yan. No? Hindi pa nga 3, paminsan 2 lang. Mag-implement ako ng HIS at LIS. Tapos na muna. Tapusin mo muna yun bago ka muna sa next. No, mga 2 tapos mga additional 2 minor, no? So gagawa mo ng plano yan kung paano ma-tolerate. Okay? So this is a different discussion. I'll just go over some use cases, no? Kasi I'm sure maraming tatanong. Paano kung ganito? Kami. Okay. So I have 5 use cases. Kung new hospital ka and what you just want is to open up with the barest minimum, gusto lang namin mag-operate. Okay. Then what you need are the HIS, the core transaction systems, capture all the transactions inside, and then put in some ancillary. Okay, the very basic PACS, LIS. Okay, para efficient na kagad. Kasi if you deal with paper, laboratory sa paper, then useless. No? So invest in that one from the start. Kasi bulk ng operations mo mga galing sa lab. Okay, manage your medical images. Yeah, so itong dalawa. Now, itong puti, nilagay ko lang, ito yung pinaka-tututukan. Pero ito, lagyan mo na ng konti, maglagay ka naman ng konting email, no, para mag-usap yung ano. And then, i-integrate mo na yung dalawa kung pwede. If you are a new hospital, but you want to be a differentiator, iba kami, no? Then introduce some level of customer engagement with Clinicality Systems. Okay? So, yung iba kahit hindi na muna. Kung andun ka na nag-ooperate ka na and you want to streamline some stuff, you really need to look at operational support systems. Ayaw natin sabihin out loud, but operational support systems also streamline manpower. So, sometimes ayaw natin sabihin na may matatanggal, pero meron mariretool, no, mariretrain. Iba yung gagawin. But sometimes meron talaga, mababawasan pa minsan. Naging leaner yung staff natin pag maayos yung implementation of operational support. And with my definition of other innovation, when you try to streamline and control cost, you look at innovations na pwedeng gamitin na viable, practical, and cheaper. Okay? So itong mga to, dapat given na to. Yung mga gray na italicized. given na yung mga yan. Okay, when you need to compete, ito, umandar ka na, no? Andito na, medyo strong na yung competition, yung kabila, nagyayabang, meron kami ganito, yung kabila, meron kami ganito, kabila, meron kami ganito. Then it's okay, you need to invest in your ancillary. Kailangan mo pa rin mag-invest in ancillary. Kaya medyo naka-bold dito. Ang ko lang dito, basically, is you look for some laboratory services, some diagnostic services that can also make you a differentiator na better than the other hospital. And then you need to start looking at data analytics. Kasi with more data, you become more competitive. Alam mo ano ang edge mo. Okay, so alam mo anong subject. Nanalo sila sa napakadami ng labs na pupunta sa kanila. Talaga, yung margin naman ng labs nila, 10 pesos lang kada exam. Ako, panalo ako sa hemodialysis. I earned 200%, no? Parang ganun, no? Iba naman yung no? But if you really want to compete, you need more data. You need to look at that. You need to be strategic about ano yung mga next steps about your investments. And that can only be done when you have information, make informed decisions. Of course, you also need to invest in customer engagement. You want to generate patient loyalty, but you don't need to compete on the initiation pa lang. You compete, hindi ka makikipaglaban dun sa mga pasyente mo na kasi nare-retain mo sila. Okay. And then the last one is if you want to focus on excellence in patient care, usually malalaki na, marami yung budget. When you look at all these ones, pasok mo na sila lahat. That's why you need to focus on clinical IT systems, implement ka ng EMR. This is where you go after better patient care, better clinical documentation. Dito na papasok. Papasok na rin yung iba, i-beef up mo to, mabuti. Telemedicine, meron na. Okay. So that's it. That's I'm sorry it took so long, but I wanted to share a lot of things, and then I hope it was useful. And if there are questions, comments, ngayon, I'll be happy to answer them. May mga questions naka-direct sa akin. Yes, we will convert the presentation to PDF, and then papadala namin sa inyo. Mas maganda kung naka-register kayo kasi at least maseda namin dun sa email. Okay, sige. Okay, nakaano na yung unmute themselves. So if you have questions.
Yes, Doc Mike, this is Dudes.
Oh, Dudes.
Yes, question. Kanina sinabi mo na you can just easily changes or modify the rates for, kasi merong social pricing for every hospital, di ba?
Yes.
All right. So kasi every year nag-i-increase yung mga hospital, like for example 5%, 10%, whatever, kung ilang percent, di ba? Diyan ba sa system ninyo, you can just put something like 5% tapos across the board na lahat na ng mga presyo, lahat na nako-convert na?
Yes, meron kaming way na mag-create ka ng standard parang algorithm. Tapos meron ring parang individual way na mag-pricing.
Okay. Kasama rin ba ito pati mga non-PNDF tsaka PNDF pricing na mga presyo?
Sinasama namin yan sa discussion kasi we always work with the accounting billing side ng even the costing side ng kasi doon yung mga pricing na nanggagaling, yung mga schemes with our clients. So tas binibuild namin according to the direction kung saan pupunta yung industry. Marami actually, even the concept ng socialized schemes, doon talaga yung malaking challenge, no? Even discount schemes,
correct.
Papasok yung HMO na pricing, corporate pricing. Medyo talagang talagang medyo matrabaho. It's always a discussion with the client para ma-come up with a good parang algorithm yung malatag ng mabuti lahat ng schemes.
So does your system also, Dr. Mike, naka-integrate na to sa PhilHealth? Meron kayong portal beacon din?
Meron kaming PhilHealth partner kasi we are not a HITP, but we created APIs to work with the API, no? Kasi batuhan naman sa internet. But we have a partner. Our partner is Stash. Pero we don't require clients to work with Stash. But our partner, para kung magtanong lalo yung mga new hospitals, kailangan namin ng HITP, meron kaming partner for HITP.
So kung naka-partner kayo sa Stash, so how long are the hospital going to pay for the services? Kasi merong yung iba pagka bumili ng system, pagkatapos wala kayong sariling integration, the vendor, the developer of SIS doesn't have the direct connection to connect to the PhilHealth, so kukuha ka ng third party like the Stash.
Oo.
So, di ba, magbabayad kasi yan in the long run kasi yung mga documents na pinapasa doon.
Okay, so i-answer ko yun on two aspect. Merong retrospective, merong prospective. Okay, so lalo na kung magpapalit ka ng HITP. The retrospective means na meron kang backlog. And kailangan mo mag-decide whether to stay with your existing HITP at ayusin yung backlog or i-onboard lahat ng backlog doon sa bago mong HITP. Okay, so may mga ganung discussions. It's going to be a case by case basis kasi depende sa saan ka lilipat. Ngayon, yung paglipat na yun depende sa dami. Karamihan ng mga HITP, maniningil talaga sila. Sabi nila, napakadami, that's like 2 years worth of backlog na kailangan natin ilagay sa system. Yung tao namin magtatrabaho, kailangan talaga bayaran yan. So ganun yung mga sa HITP.
One last question, Dr. Mike.
Yes.
We are, like for the ancillary, you're talking about the PACS, di ba? So meron ka bang kasi sa LIS naman, alam ko kayang-kaya niyo na mag-integrate Ginagawa na natin sa Centus before, di ba? So kung sa PACS, do you have a PACS?
Wala kaming PACS system that's but let's explore dudes kung kailan. One of the things na I'm always willing to do naman is to explore and do some R&D. Let's see some viable ones.
Okay.
Siguro ang kaya ko lang sabihin is we did the vendor evaluation for the medical city in terms of RAS and PACS when I was the program director of all the nag-change kami naman so kasama yung PACS. And then we look at the market and sabi there are some viable options na pwede natin palang ilagay. Nakita namin limited pala yung options ng ibang hospitals. Lalo na yung iba parang umuwi na sa kanila, Carestream na wala na ng operation sa local. Mga ganung bagay, no? So kailan hindi ko alam hindi ko masyado nakatuto ako sa HS EMR. Yun ang realization namin.
Matutulungan kita dyan. Alam mo ba?
Ha?
Matutulungan kita dyan.
Yes. Sige. Mag-usap tayo dudes when we have opportunity.
Okay. Thank you so much.
Thank you. Meron pa yata mga nag-raise ng hand. Eliza, nakita ko nag-raise ka ng hand. Pwede yata yan.
Yes, Doc Mike. Thank you for the very informative lecture. Actually kasi yung PHA, they initiated this free platform, telemedicine platform. Are you familiar with the Philippine Virtual Hospital? Okay, they initiated that. It's like, free subscription, free everything. You just need to register and it's, free. And it has a lot of the telemedicine functionalities and it's accessible to all Filipinos actually globally. So, and then it enables you to, have SOAP notes, parang email communication, parang yung all the functions of parang EMR using the PVH. Anyway, I will send you, maybe you can explore that. Pero they said kasi kunyari right now, parang we're still in the process of building a hospital. So kunyari ako, I don't want, I'm dealing maybe 80% of my time now sa telemedicine. So parang kunyari it's parang 'di ba attractive for me to try this at no cost, 'di ba? So tapos ngayon sabi nila it's interoperable. So kung kunyari ba nagkaroon na kami ng hospital and we want, of course it's in our to have an EMR and HIS. Sabi nila yun nga open source tapos interoperable. What do you think of that? Yung kunyari lang, meron na akong repository doon of like 100 patients. Ano yun? Pwede ba yun yung data doon makuha nung parang pag sinabi nila na open source na may transfer doon sa gagawin na telemedicine within the hospital? Or
Okay.
ano yun? Or is it a trap? So I don't know.
Hindi naman I don't want to say it trap, no? Kasi parang medyo negative connotation yung trap. But in a way, merong lock-in. No? Parang tawag doon ng vendor lock-in. When you have your data with a vendor na hindi mo control, especially sa mga cloud-based, ando yung data mo. No? There is some sense ng lock-in kasi it takes technical expertise to take it out. But you can take it out. No? So, gano'n naman lagi. Hindi naman sila magsabi, hindi mo pwede kunin yung data mo. Hindi. Sa'yo pa rin yan, pero gawa mo na parang paano mo maano. So, the idea of taking them out and putting it in kung sa ng hospital, maraming levels ng interoperability na pwedeng itingnan. It could be just yung kunin lang, tapos ilagay, store. Pwede naman na mag-interchange na real-time na nagbatuhan. But iba kasi yung kayo na discuss about telemedicine, there will always be a difference between how telemedicine is implemented with practitioners and how telemedicine is implemented inside hospitals. Now, yung mga SOAP notes mo doon sa loob ng visits ng private practice, pwedeng gawa ng summary, tapos yung summary na lang ang ibabato doon sa hospital. No? Para at least iba yung approach doon. Even in the US, when you create referrals to a hospital, you always work with summary, medical abstract, clinical abstracts. No? Laging nakasummarize yung it's like a referral, tapos yun na lang ang batuhan. Yun pwede tayong mag-explore ng ganung option. Basta sa loob ng hospital, ready sila magtanggap. Kasi pwede ka naman magbato ng referral, pwede ka magbato ng clinical abstract, pero wala namang sumasalo, hindi na-integrate dun sa system. No? So, medyo medyo may mga kailangan pang technical aspect na kailangan tingnan, even including yung patient registration. No? Baka bagong pasyente yan, lumang pasyente ng doktor, pero bagong pasyente sa mata ng hospital. Mga ganung bagay.
So are you saying that it's too cumbersome to do it and parang you'd rather start anew? Like,
Hindi
with
naman,
the-
no. Actually, maganda kung meron ng data. It just needs a technical
So like if I
person.
want just continuity of care and may
Yes.
data na ako, so pwede din naman. Kaya lang there's process to do it, but it's doable. Parang ganun.
Yes, definitely.
Okay, thank you.
Kung imagine nyo yung, if you try to imagine the clinical benefits of the CF4, if it is seen as a discharge summary, you already have digitized clinical documents na pwede mong ibato sa iba. Huwag mo lang isipin na CF4, isipin mo discharge summary siya. Diba? So, sa side ng hospital, the hospital is ready to create these summaries. Even inter-hospital summaries, ginagawa naman na yan. So, ang tanong na lang is, do you open up this idea of exchanging summaries, not only across, not only to PhilHealth, but also to other hospitals, but also private practitioners, tapos bi-directional. Yung private practitioner, meron siyang summary niya, ibabato niya sa'yo. So, ito na yung patient ko, ito yung ganito niya, ganun. Okay, so, open discussion. On the technical aspect, maraming doable, marami lang mga detalye na kailangan ayusin.
Thank you very much.
Meron mga questions? How long po ang paggawa ng HIS? Okay. Depends on the if you are on the route of developing your own. So meron ako makilala na ganun. I started my career in St. Luke's where we built our own. No? So I was the lead developer for the HIS when BGC opened. So ako yung nagano. It depends on the requirements na kailangan niyo. But kung maganda yung team mo, no, siguro at least mga 3 team mo. Tapos gusto mo lang mag-operate, then you could probably do it around 6 to 9 months kung kailangan. Pero that's only the bare minimum kasi ang pinakamahirap in terms of the HIS is the domain expertise. Kasi when you work with IT, they could say na kaya namin yan, ano ba yung form na yan? You give them the forms, no? But they don't have concepts ng ano ba ang patient registration, ano ba yung admission, ano ba yung bed management. Yung concepts na yan, yun ang medyo challenging. madali yung kumuha ng programmer pero yung mag-create nung na makita yung big picture in terms of domain. Kasi may mga challenge doon sa housekeeping, papunta sa billing. Yung tanong kanina ni Dudes was about schemes. Hindi mo pwedeng hindi i-describe ng mabuti yun sa developer pag hindi niya alam. Ganito kasi nabibill pagka yung ganito yung sa room charges, pag ganito yung So yun lang yung pag develop ka ng sarili mo, yun lang yung challenge. You should always have a very good resource person, a product owner na part siya ng project at siya nag-explain to sa developer kung ano ang kailangan gawin, paano ma-interpret yung isang bagay. Okay. Isa pang tanong is web-based. Ano yung web-based? If it is asking about our solution is cloud-ready and web-based, but we can implement it on-premise and even on cloud, depending on the hospital. Right now, the reality is some hospitals will require it to be on-premise because of our bandwidth constraints. So ayaw natin na nagtitingin tayo ng lab results, hindi natin ma-access kasi down si PLDT. So ayaw natin yun, gusto natin na sa loob, sa on-premise tayo. So may mga ganong requirements. Meron pa ibang questions? Kung meron pang ibang questions, baka overwhelmed kayo na sa lecture. I'm hoping na naging helpful siya sa inyo, even at least some aspects ng planning. You are welcome to email me, Mike Muin at medprojects.com. I really like discussing and finding solutions to other problems. Kung meron kayong mga ideas on how mga improvements, on even just generic questions lang about sa hospital IT side, I really welcome them. Or you can email my team at medprojects.com para kasagutin kami sa inyo. Okay. Kung wala na, Marian?
Yes, okay. No more questions? Okay, sige, salamat. We hope all of you were able to get a very informative webinar. Dr. Mike, thank you very much for your time. We will be having our next webinar on 26th of October. So this title is Healthcare Interoperability and Next Gen Connect. The webinar covers the importance of interoperability in healthcare IT systems. Our speaker will be Dr. Michael Fong. Hope to see you there, and may you invite other doctors and hospitals that are connected or would like to know more about this webinar. So aside from our webinar, we hope you can give us the opportunity to present to you our company, Med Projects Inc. You can also check our website at www.medprojects.com. On behalf of our team, thank you for allowing us this afternoon, and hope that this activity has given you a much clearer understanding on healthcare and hospital solution. Okay. This is Marian Abo speaking, Sales and Marketing for Med Projects Inc., your healthcare IT solutions. Thank you, stay healthy, stay safe, and God bless.
Thank
Okay.
you,
Thank
everyone.
you. Thank you, everyone.
Thank you, Dr. Mike.
Thank you. Thank you.
Thank you, Doc.
So much, Doctor.
Thanks, everyone.
Maraming salamat po sa inyo.
Thank you, Dr. Mike. Thank you for your team.
Thank you.